Hello and welcome to the City of Fredericksburg's COVID-19 Weekly Report. We're back after a delay for the snowstorm and the holiday season, but let's get right to the situation. As we told you last month, the number of COVID cases had increased. Well, since the first of the year, that situation has gotten a lot worse. The number of COVID cases throughout the region and throughout the Commonwealth and really the United States of America has tripled or even gone greater than that. The number of case numbers that we're seeing and the number of percent positivity that we're seeing in the local area is unprecedented since the beginning of the pandemic in March 2020. To just give you some information and some statistics, as of today, from the statistics that we got yesterday, the percent positivity, the 7-day average, is now 43.5%. That's the highest that it's ever been since the beginning of the pandemic. Before, we were about 19%, and we've jumped way above that. The number of daily cases we're seeing is in the 500s and 600s, where before we were down in the 100s and 200s. The total number of people in the hospitals in the Rappahannock Area Health District now stands at 212. Remember, the last time we talked back in late December, we were down around 70 or 80, and now we're at 212. So the amount of COVID, whether it be Delta, whether it be Omicron, doesn't matter, has exploded in the region and exploded throughout the Commonwealth. Yesterday, the governor of the Commonwealth of Virginia went ahead and put out an emergency order, a state of emergency related to COVID and the healthcare crisis that's going on. This has allowed hospitals to expand their capacity, to add more staff, and to put patients in non-traditional areas that you normally wouldn't see in the hospital. To give you some examples of what's going on since then, Mary Washington Healthcare has gone to what they call a crisis standards of care, allowing them to add capacity and put people in non-traditional areas. They also have the capability of monitoring people at home that have COVID with oxygen and things like that remotely. They're doing everything they can to try to take care of the patients that are coming in. The biggest problem there is they are at 100% capacity and really have no more capability to do that. Most of the other area hospitals are in the same situation. So we have to start looking at what we can do to try to prevent COVID and try to help our situation get a little bit better. And probably the best thing that we can do more than anything else is, if you haven't received a vaccination or you're due for a booster, go and get that done. Again, the Community Vaccination Clinic is available at 1877 Carl D. Silver Parkway. That's in Central Park. They certainly have all 3 vaccines available. They have boosters available. So if you haven't gotten the vaccine series or you haven't gotten a booster and you're due for one, by all means go and get the vaccines, because they cut down the amount of severe illness, the chance that you will end up in the hospital or on a ventilator or anything like that. The other thing is, if you have signs and symptoms of COVID, by all means try to isolate yourself at home or away from other people and things like that, and consider yourself having COVID. You may not be able to get a test right away, as tests are in short supply. But if you do need testing, or you feel that you need testing, it is available in the community. You can either schedule one through a local pharmacy, you can schedule one through an urgent care clinic or your primary care physician, or you can go to one of several community testing sites. The one for the city of Fredericksburg is now located at Dixon Park. That's off of Dixon Street in the southeast corner of the city. It is from 2 to 5 p.m. on Thursdays. They'll be there every Thursday this month, the month of January. Unfortunately, with the rise in the number of cases of COVID and the people wanting testing, you now have to schedule that ahead of time. There are no walk-ups or drive-ups without having an appointment. So we'll try to give you a link later on in our program for the ability to sign up for that. There's also COVID testing with the same requirements on Wednesdays at Stafford Hospital Center, just outside Stafford Courthouse. And there's also testings on some Tuesdays at Ruther Glen, Virginia. And you can look those up on the Rappahannock Area Health Department's website and things like that. Again, the situation is unprecedented. We have a lot of COVID in the community. We want to try to make sure that you stay safe and you have the information to stay safe. By all means, continue to wear your masks, especially when you're around large crowds, indoor and poor ventilated areas, especially when you don't know the vaccination status of other people around you. If you haven't gotten a vaccination, by all means consider getting one. If you haven't gotten your booster yet and you've had the two shots or one shot, Go ahead and schedule yourself for a booster if you're due for one. Wash your hands, and if you're at sick, please stay home and isolate from people. That's the best thing we can do right now to try to get through this particular crisis. We're hoping that the crisis itself will relent in a couple of weeks, but we'll just have to keep following the numbers and see where it goes. But right now, the situation is at a critical juncture, and we need everybody to do their part to try to help out. We'll provide more information as we get it and as we come through, and see you again next week. Thank you.